doctors and nurses, what were the creepiest last words you ever heard from a patient before they passed away? In the cardiac ICU, we once cared for a gentleman who was DNR and on comfort care. He was demented, swearing constantly, yet sometimes had flashes of clarity. During those moments, he asked to see his brothers, though both had already passed away. After one particularly concerning heart rhythm, he briefly returned to sinus rhythm, looked straight into my eyes, and asked, "Hey, what's your name? What do you do here?" When I answered that I was a nurse, he grew quiet. A while later, he looked at me again and said, "Fuck you." Roughly 20 minutes later, he was gone. Honestly, if someone's going to leave this world, that's one way to do it. Guns blazing, no consequences left to face. In the same cardiac ICU, we had a patient with a pulmonary artery rupture, a rare but known complication of a Swan-Ganz catheter. Just moments before, he had been joking around with us. Then suddenly, bright red blood began gushing from his mouth. His final words were, "Why is this happening to me?" That sentence still haunts me, even years later. When I worked in an assisted living community on the dementia and Alzheimer's unit, I had a favorite patient who had been steadily declining. I checked on him often, and we used to have long conversations filled with laughter. But during the last 2 weeks of his life, he became completely silent, no longer responding to anyone. One evening, after finishing my medication rounds, I went to say goodbye before leaving. I told him I'd see him the next day. For the first time in weeks, he looked at me, smiled warmly, and said, "You look like an angel." He died the very next morning. That memory has stayed with me. As a nurse in the ER, I once had a patient who came in with shortness of breath. His condition deteriorated quickly, especially during transfer to the ICU. After we moved him into his bed and replaced his lines, he calmly adjusted his own pillow, laid his head back, and without saying a single word, let his eyes drift blank. It was as though he chose to make himself comfortable before dying. I'm not a nurse, but this happened with my father, and it still gives me chills. My dad had multiple sclerosis. He was diagnosed at 20, married my mom at 24, had me at 29, and died at 44, just 15 days before turning 45. 6 months before his death, he was placed on hospice. While planning his funeral, my mom joked, "Tim, the best thing you could do is die on a Wednesday. That way we could prepare the body Thursday, have the viewing Friday, and the memorial Saturday so more people could come." The day he passed, my mom, sisters, and I were 5 minutes too late. Afterward, a nurse pulled my mom aside and asked if that date meant anything. My mom, exhausted and confused, said no. The nurse explained that the previous day he had repeatedly asked what day it was. When told it was the 20th, he seemed irritated but said nothing. On the morning of the 21st, when told it was Wednesday, he smiled, squeezed his nurse's hand, and immediately passed away. It was Memorial Day weekend, and we held his service exactly as he and Mom had planned. Over 250 people came, filling the tiny church more than it had ever been. Even in his last act, my dad tried to make life easier for us. I once found a patient, on comfort measures only, sitting beside his bed, which startled me since he'd been mostly unresponsive. After helping him back into bed, he asked me why so many people were in his room. Then he suddenly fell quiet, and I realized he'd stopped breathing. Since he was DNR, there was nothing we could do. To this day, I wonder if he was speaking, about me and the CNA helping him, or if he was seeing something or someone we could not. I once cared for a DNR patient heavily medicated on morphine. She was hallucinating, sometimes reaching for invisible things or trying to climb out of bed. My role was to keep her safe. At one point, she grabbed my arm, pulled me close, and, in a furious voice, said, "Kill me." That shook me for a long time. Toward the end of my shift, I checked on a patient in good spirits. She had been joking with me all evening, though her condition was fragile. When I asked how she was doing, she replied, "The old gray mare ain't what she used to be," wished me good night, and smiled. By morning, she had coded and passed away. I'm not a nurse or doctor, but I work as an apprentice funeral director. While collecting a body from a nursing home, another resident saw us passing with the stretcher and joked, "I'll see you next week, boys." Sure enough, we returned a week later for him. During an early shift, I took over care of a patient who had been anxious all night. Vitals were fine, ECG was fine, but he remained panicked. I asked someone to sit with him for reassurance. He grew worse, breathing heavily, curled in a fetal position. I encouraged him to lie on his back to help his breathing. He shook his head and said, "I won't make it until the doctors get here, and if I turn to face the other way, I'll die." He repeated this several times. Just as the doctors arrived, he arrested and passed away, lying exactly in the position he refused to move into. To this day, I'm convinced he knew. My grandfather, on hospice for only 2 days, once told us he had to go with the little red-haired girl. We didn't understand. After he passed, the hospice nurse arrived. I answered the door and was stunned. She was about 5'2", with striking blue eyes and the most beautiful red hair. I couldn't even speak, but my grandmother smiled and said, "Please come in. He's been waiting for you." On my very first hospice case, the patient was on morphine and began mimicking the act of smoking. She grabbed my hand, looked at me with pleading eyes, and simply said, "Please." She had no family, no friends. Only her lawyer came later. I sat with her body until the coroner arrived. I've only taken one hospice case since I had a stroke patient who seemed to be recovering well until pneumonia set in weeks later. At 4 a.m., his last words to me were chilling. "You took his girl, and you will burn in hell for it." The strangest part is, I had actually once dated a friend's girlfriend. Somehow he knew. 3 final memories haunt me. One was an 83-year-old woman who asked, "My mom's here. Are we going?" She died minutes later. Another was a lady who said, "I think I'm going to die today." Despite stable vitals, she had a heart attack a few hours later. And the third was the creepiest, a sweet old woman who asked to dress in all white. When asked why, she replied, "Because the man in black is here." She described him as tall, in a top hat with glowing red eyes. She kept tracking him with her gaze, even looking over the CNA's shoulder as though he was standing right behind her. She died unexpectedly that night. That room gave me chills for a long time afterward. Right now, I'm writing my mother's eulogy for her wake tomorrow. I feel compelled to warn anyone who smokes to reconsider. My mom smoked her whole life, and eventually it caught up with her. She was diagnosed with terminal lung and pancreatic cancer, and the tumor spread to her vocal cords, leaving her barely able to speak. From diagnosis to the end, the disease overtook her so fast. From the moment of her diagnosis until the day she passed away, less than 2 weeks went by. At first, her voice gave out. Soon after, she began struggling to breathe. Her strength faded quickly, and walking even short distances became impossible. Eventually, she couldn't walk at all, and even eating became difficult. On the night she died, I let her smoke a cigarette, something the doctor told me didn't matter anymore. My sister and I helped Mom into bed, and we both knew, deep down, that this was the final time. We stayed with her for hours, holding her close. At one point, I broke down, and Mom, gathering what strength she had left, looked at me and said loudly, "Don't be sad." That moment has stayed with me forever. She was scheduled to begin hospice care that Monday, but she never made it. Lung cancer is merciless and fast. I hope none of you ever have to experience it. Think of that next cigarette. It really is only a matter of time. Anyway, enough preaching. My very first code as a nurse involved a middle-aged mother who likely suffered a brain bleed. When I checked her vitals, she was restless, agitated the entire day. She bent her IV pole somehow, tore off her gown, ripped away the bed sheets, and even yanked off her heart monitor. I needed her vitals before beginning a transfusion, but she wouldn't stay still long enough for any reading. Believing it was anxiety, I had given her a sedative and prayed it would take effect. She kept gripping my arm, pleading, "Come here, look at me, help me." The fear in her eyes is something I'll never forget. Instead of comforting her, I snapped, "I'm trying." I regret that response to this day. Moments later, her eyes drooped, her mouth closed, then suddenly her eyes flew open, glazed over, and she drew her final breath as a coworker assisted me while I called the code. Another memory. When I was still a student nurse, I cared for a woman with end-stage renal failure. As I was chatting with her and rubbing lotion into her hands, she suddenly paused, looked over my shoulder and said, "Bill's here, love. I've got to go." Then she stopped breathing. Later, I read her chart and learned Bill was her late husband, not a medical professional this time, just family. My beloved grandfather was hospitalized with pneumonia and sepsis. I thought he would recover, but he asked to see me and my family. We went, my parents, my husband, and my 2 young boys. Grandpa couldn't speak, but he was still alert, watching. Television. He motioned for pen and paper, scribbled a note, and handed it to my eldest son, who was 12. It simply read, "I love you." As we left, I realized he had been saying goodbye. I broke down crying. Before I even made it home, Grandpa had passed. It felt as if he held on just long enough to see us one last time. In my dreams, he still visits. Not as the frail man he became, but as a strong, healthy 40-year-old striding energetically across the yard of the home he once shared with Grandma. That's not how I ever knew him, but that's how he chooses to appear. I work as a certified surgical tech in a specialized field where most of my patients are elderly. This isn't about one particular person, but rather an observation. More than once, I've been among the last to see someone conscious or even alive. I'll never forget patients who confessed regret, wishing they'd sought treatment sooner or admitted they were terrified before anesthesia. Some who seemed low risk never woke again. That's why I always say, tell your loved ones how you feel. You truly never know when it will be the last time. When my dad slipped into unconsciousness around noon, we got him into bed. When I told him, "I love you," he squeezed my hand. We stayed with him the rest of the day. Around 3 in the morning, his breathing shifted. Then, suddenly, he bolted upright, wide-eyed. He looked at his wife, my sister, then me, smiled, exhaled, and was gone. As a hospital chaplain, I once visited a patient in the ICU. On her bedside table were 10 to 12 oranges. We spent 20 minutes talking about them. Before I left, she told me, "Something's going to happen." The next day, I learned she had passed that night. At first, I wished we had talked about something more meaningful, but a nurse reminded me that lighthearted conversation was what she wanted. And honestly, maybe that's the best way to leave this world. During my time in the Army, stationed in Pakistan for humanitarian aid after an earthquake, we responded to a horrific school bus crash. Dozens of children were injured. The first child we carried into the triage tent screamed something in Urdu. When the doctor asked for a translation, we were told he said, "The spiders are eating Papa." The room went silent before we continued triage. That moment still chills me. Death often comes after permission to go. Patients seem to wait until their loved ones are ready to let them rest. As one of my nursing professors called it, that's permission to die. It's heartbreaking, but it's better than leaving them clinging on in guilt. I spent years as a hospice nurse, and though it's heartbreaking, it can also be profoundly meaningful. Unlike hospital nursing, where gratitude is rare, hospice is often filled with peace, love, and acceptance, but not always. I once cared for a 20-year-old gang member with aggressive liver cancer. He was furious at the world, lashing out, at his family, even spitting at them. His mother begged him to accept Jesus, but he cursed at her. His last moments were chilling. As death approached, his mother again whispered for him to go to the light. He opened his eyes and spat out, "Fuck you, Jesus!" Seconds later, he turned his head, face contorting with pure terror, staring at something unseen. His final scream, "Oh crap! Oh crap! Oh no!" was followed by a guttural noise before he collapsed back, lifeless. Everyone in the room was shaken. I needed 2 days off afterward and, truthfully, never wanted to know what he saw. My grandmother died in 1989. She had been widowed since 1965 when my grandfather Bob passed. She never remarried but lived a full life. In her final moments, she cried out, "Bob! Bob! Here I come! Oh, honey, I've missed you so much!" We often joked we were just glad she didn't shout, "Bob! Who the hell is that?" Another memory. Years ago, when I was a junior resident, I prepared discharge paperwork for a 96-year-old woman recovering from colon cancer surgery. She was sharp, witty, and ready to leave, but she kept insisting she was going home to Bill. Her son corrected her, reminding her Bill, her husband, had died years earlier. She smiled and said, "No, he came to see me this morning. He's taking me home." It was the first odd thing she'd said all day. Her labs and vitals looked fine, so we proceeded with discharge plans. Minutes later, a code was called to her room. She was a DNR, so no interventions were done. She had passed. Her son, surprisingly, accepted it calmly. As eerie as it was, I couldn't shake the feeling that Bill really had come for her. I was staying with my grandma in a cot next to her bed as she was actively passing. She hadn't said much for the last few days. After my shift ended around 11:00 p.m., I went home, said goodnight to the dog and my girlfriend, and then drove to her place, arriving around 1 a.m. I had a feeling it might be her last night, so I knelt beside her, told her how much I loved her, and reassured her that it was okay to let go. It was her time, and she had been such a wonderful matriarch to our family. I tried to stay awake, but eventually drifted off. Around 4 a.m., the CNA woke me to tell me she was gone. I still go back and forth between feeling guilty for falling, asleep and grateful that I was there at all. Fluffer ruled. I miss her. She didn't say anything to me, so maybe it's not relevant to this thread, but it feels good to write it down. I'm a fourth-year medical student, and honestly, I haven't heard too many creepy last words. A lot of patients near the end aren't in good enough shape to speak clearly. Most of them, in my experience. But one case stands out. We had a man in his early 70s who was an absolute train wreck of health problems. Normally, Occam's razor lets you trace a death to one worsening cause, but not this guy. He had metastatic melanoma, severe multiple myeloma, lung cancer that had spread, and basically 3 different cancers at the same time. He weighed maybe 80 pounds. Suddenly, a code blue was called over the PA system, and the whole team rushed in. Chest compressions, epinephrine. After about 3 minutes, we got a pulse back. His chest was basically destroyed from compressions. There were problems getting a line into a vein, so I think they drilled into his bone, a procedure catastrophically painful if you're awake. The man opened his eyes, looked around, and seemed terrified. He couldn't speak or move much, but the fear on his face was unforgettable. Then the nurse, who had been quietly standing in the corner the whole time, said, not sarcastically, "He told me he was DNR. The family even put the paperwork in that folder on the chair." Immediately, we stopped, gave him morphine, changed his gown, and covered him up. I held his hand until the resident declared him. It was the first death I'd ever witnessed. Dead people are so cold. No one had ever told me that. Somewhere, a mistake had happened. His computer file hadn't been updated. Only that nurse knew because the man and his family had told her. To this day, I can't understand why she didn't shout at us to stop, or at least tell us to check the folder, with his living will in it. Whoever made that charting mistake, doctor, nurse, secretary, should have been raked over the coals. The family was surprisingly understanding, but if they'd wanted to sue, it would have been a slam dunk. I'll never forget the way he looked, around. I just hope he was disoriented, because if he wasn't, that would be a truly horrible reality to face in your final moments. On a lighter note, years ago, I bumped into an old classmate from high school at a gas station. We chatted for a few minutes, and as he walked away, his last words to me were, "We're going to the titty bar." That same night, he died in a car crash as an unrestrained passenger. He and his buddies had been trying to catch air going over a hump in the road, but they crashed into a retaining wall. He was actually a really nice guy. I can't write this without sobbing, but 3 years ago, my grandma passed. She was as stubborn as ever, and the hospice nurse kept telling us, "It won't be long now. Anytime. Anytime." There were about 20 of us in the room, her kids, her grandkids, even her 80-year-old sister, all standing around her bed, holding hands, waiting. It felt uncomfortable, just standing there. Finally, I leaned down, whispered in her ear that I loved her, and told her it was okay to go. She and I were very close. After I did, my mom followed, then my grandma's sister. After a while, my mom said, "I remember a long time ago she told me that she wanted to hear 'I'll Fly Away,' her favorite hymn, as she entered heaven's gates." Everyone chuckled softly. Then my 80-year-old great-aunt began singing, "One glad morning, when this life is over, I'll fly away, to a home on God's celestial shore. I'll fly away." Without hesitation, all of us joined in as best we could, crying as we sang. Not 10 minutes after we finished, her heart stopped. She just needed a little help to fly away. I've never shared that before. Thank you for letting me. And if I butchered the hymn, I apologize, but it was such a touching moment. I'm not a nurse or doctor, but this reminded me of something that happened with my grandparents. While visiting my grandma in the hospital after she suffered a stroke, my grandpa suddenly had a massive heart attack. Miraculously, he survived, and they placed both of them in a shared hospital room. My grandpa was very weak and eventually passed. Just minutes before he died, my grandma suddenly said, "I'm dying," as if she could feel him slipping away. She actually lived another month before joining him. My grandfather's brother died exactly 6 hours after my grandfather. Just minutes before his own death, he said, "I'm going to see you again, brother." He had no idea my granddad had already passed. The family had planned to tell him the next morning because he was having a rough day. Not final words, but a final action. I was a first-year med student doing clinical rotations. They would send us to practice histories and physicals on patients willing to spend an hour with clueless students. Usually, chronically ill patients awaiting placement. Agreed. I was interviewing an octogenarian, status post-dynamic hip screw, waiting for rehab transfer. We were going through my checklist when he suddenly stopped mid-sentence, stared over my shoulder as though someone had entered the room. I glanced back, but no one was there. When I looked at him again, his gaze was fixed, his mouth trembling, slightly, and then he died, instantly. 1 second talking, the next gone. A massive pulmonary embolism, a saddle embolus. I've never seen someone die so suddenly since, and I'll never forget the look in his eyes, as though he saw death itself standing over my shoulder. About 20 years ago, I worked as a secretary in the ICU. We had a patient in his mid-30s with full-blown AIDS. He was listed as DNR, which seemed contradictory since he was in the ICU, but that's how it was. I can't remember if it was pneumonia or something else that landed him there. Eventually, things started to go downhill. Instead of coding him, the nurses came in with drugs to relax him and keep him comfortable. Then, out of nowhere, he changed his mind. He started screaming, "I don't want to die yet! Please do something!" They called a code, but in the end, he didn't make it. My grandfather died this year at 86, while in a Nashville hospital for pneumonia. I had planned to visit the next day, but my mom called and said he was passing soon and asked if I wanted to talk to him. I said yes. Our last conversation went like this. Me: "Hey, Papa, it's Marky. How's it going?" Grandfather: I'm sick. Me. Can you hang on a few more hours? I'll be there. Grandfather. Nope, I'm out of here. Me. I love you, grandfather. And that was it. He died before the phone even hung up. It bothered me deeply how calm and accepting he was about death. I think about it every day. My brother died just over 2 years ago from cancer. He was a medical doctor, and I'm a PhD in history, so between us, I guess we covered both ends. In his hospice room at the hospital, a friend came to visit on Steve's last day. Steve said, My heart is under the TV in my room." His friend Bob tried to reassure him. "It's okay, man, don't worry." But Steve repeated, "No, my heart is under the TV." He died later that night. A couple of days later, while gathering his things, we found his stash of pot under the TV. He had only started smoking after his diagnosis for fun during treatment, and Bob had been the one to supply it. It seemed like Steve was trying to tell him where it was. I'm not a doctor or nurse, but I'll share one more. My grandmother, dying from cancer, asked for a Mountain Dew the afternoon she passed. She had never drunk soda in her life, but my father loved it. He went to the vending machine and got 2 cans, and they drank together. Even with the hole in her throat, she sipped it and said, "Wow, that's delicious." Not long after, she was gone. To this day, I tear up whenever I drink a Dew. There was a patient gobbling down his breakfast, refusing to have his blood glucose checked. We knew he would need insulin because of his history. I expressed my concern, and he once told me, "I've faced death many times before." The man was nearly blind and missing a few fingers. You get the picture. When I came back 30 minutes later to check on him, he was unconscious and turning blue. We coded him, revived him, and sent him to the ICU, but he was basically brain dead. A week later, they pulled the plug. It turned out he had choked on during my first week as a CNA on a hospital floor. I had a sweet patient who loved asking me about nursing school. Right before bed, I helped her move from her chair. She jokingly danced with me for a few seconds, humming an old tune before sitting down on the bed. As she drifted off to sleep, she thanked me and said, "Don't worry, it'll be okay," referring to how nervous I was about the new job. I assumed she was fine. She was even scheduled to go home, but about 4 hours later, she died from complications with her medications. The next morning, the very first song I heard on the radio when I got in my car was "Shut Up and Dance." That messed with me for a long time. I'm a surgeon, and though I'm not sure if this counts as creepy, I once had a patient on his deathbed who kept repeating, "The body is in the woods next to the oak tree," over and over until he passed. The police searched the woods behind his house, but found nothing. My grandfather always claimed he knew exactly when he would die. He insisted it would happen on May 26th at 12 noon. Near the end, he often told us his time was almost up. The morning of May 26th, around 8 a.m., he called my dad. They spoke for about an hour, though no one knows what was said. My dad refuses to share. Before hanging up, my grandfather said, "I'm not feeling great. I'm going to get a snack and take a nap. I'll see you on the other side." An hour later, his girlfriend called. He had died in his sleep at 10 a.m. after eating half a can of Pringles. About 5 years later, my dad started saying similar things. He was in poor health at the time and kept claiming he would die on October 10th. That morning, he admitted he didn't feel well, which was unusual for him, but he carried on with his day. Later, while heading to a work dinner party with my mom, he turned to me and said, "Well, I'll see you on the other side. I love you." That night, after the party, my parents came home. My dad went straight to bed without a word. According to my mom, he sat on the edge of the bed in his pajamas, mumbling to himself. When she asked what was wrong, all she could understand was that he needed the bathroom. He got up, walked to the toilet, sat down, and collapsed. Blood was everywhere. Panicked, my mom called my brother Thomas. Minutes later, he arrived, dragged my dad to his truck, and rushed him to the nearest hospital. During the 15-minute drive, my dad died 3 separate times, but my brother managed to revive him each time. After 2 weeks in the ICU, he was transferred to a larger hospital where doctors placed a stent in his liver that ultimately saved his life. Today, he's completely fine, but if we had waited for an ambulance, he would have died, just as he had predicted. TL. Dr. My dad and grandfather might have been psychic. I'm not a medical professional, but when my dad was dying at home, he'd been mostly out of it for days. Occasionally, when conscious, he'd talk about people in his room, climbing the walls, hiding under the bed, just strange, unsettling things. The last thing he said to my sister was, "Are you going to bury me today?" He passed the following day, and it haunted all of us. My neighbor and longtime friend developed lung problems but was doing well enough to be taken off her breathing machine. She seemed to be on the mend, but things turned suddenly. She waited until all her family had gathered to say goodbye. Once they were there, she looked at her daughter and said, "Grad school," then passed away. Her last thought was her daughter's future. That daughter is now about to graduate with that very degree. I miss that wild, fun woman. When my great-grandmother passed a few years ago, we drove 12 hours to see her after hearing she had been placed in hospice. As we arrived, they told us she had just passed minutes earlier. My family was gathering themselves outside, but I rushed in, somehow knowing she wasn't completely gone. I sat beside her, held her hand, and she took 2 long breaths. Then she was still. It felt like she had waited for me. The strange part came later. After moving her to the goodbye room, we all said our farewells. Then we gathered in the den, where there was a piano and radio. We hadn't been there for more than 5 minutes, when the radio turned on by itself, playing one of her favorite old songs. Quick backstory. When I was 6, my uncle was killed by a drunk driver. When I was 10, my best friend was killed by her father, also drunk driving. Then at 15, my grandmother, Mom, was dying of cancer at home. I had always been terrified of death, but that day changed me. When I got home from school, my mom said, "This is it. Go talk to her." While she made phone calls to the family, I sat with my grandmother. She was unusually lively, talking and joking, more herself than she'd been in weeks. She insisted my mom go to the store to fetch something she wanted, and though reluctant, my mom left. As the rest of the family gathered, my grandmother slipped into a deep sleep. Just as my mom returned, parking the car outside, my grandmother suddenly opened her eyes, not looking at us but at something else. With a shocked expression, she called out her brother's name, who had been dead for years. Moments later, she passed peacefully. Watching her face convinced me there's an afterlife, that people aren't alone when they go. She didn't want my mom there for her last moment, and for some reason, she waited until she was gone. That experience erased my fear of death. Even 21 years later, I'm not afraid. This isn't about a patient, but about my fiancé's grandfather, who passed in January. Once we got together, I often helped take him to the doctor. Eventually, he was diagnosed with congestive heart failure and told the end was near. The hospital was an hour away, and since both my fiancé and I worked full-time, we often slept in the truck just to be there early. One morning in the ICU, I rested my head by his leg while he slept. My fiancé went to get coffee. When he returned, he and his grandfather talked. His grandfather was fading in and out, singing old hymns, sometimes pleading with God to take him. Then he rubbed my head and said to my fiancé, "You've got a good one here. Don't let her go." That meant the world to me. I'd never had grandparents, and he became the closest thing I ever had. The very last thing I heard him say was, "I love you too." We made sure to tell him we loved him every time we left the room, and he always answered back, until he finally fell into a deep sleep and never woke again. I miss that man deeply. Not a creepy one, but meaningful. My uncle, a sailor who loved the sea, was placed in hospice after coming off life support. The next day, he asked to go outside to look at the water. It was a sunny, breezy day. He gazed out at the ocean, took a final breath, and passed. It was as if he had planned it. A peaceful death. Though these aren't last words, they're relevant. My grandfather's brother often had strange visions, though he wasn't considered psychic. The morning after my great-grandfather, his father, died, my grandfather went to tell him the news. His brother simply replied, "I know. I saw the angels take him last night." Coincidence? Maybe. Creepy? Definitely. He pointed toward the empty doorway with a smile and said, "Here." One patient told me, "The devil has been in my room all night, but don't worry, God is with you." Sadly, his death was terrible. He suffered a violent seizure, died with his eyes wide open and a horrifying grimace fixed on his face. Throughout the night, he had shouted about the devil, repeating over and over, "Get out of here! This building's going to blow." I'm an oncology nurse, and this will probably get buried, but many of my colleagues and I have had patients look at us and say, "I'm going to die today." Almost every time someone said that, they either passed away or coded that very day. It unsettles me each time, because you can tell they sense something isn't right. I'm not a doctor or a nurse, but my grandmother was in hospice care with brain cancer. She'd been there for 5 days, unresponsive for the last 3. My father, aunts, uncles, and I stayed in her room, sharing drinks and conversation while keeping her company. My aunt spent nearly every night by her side. One morning, her husband encouraged her to take a break and get some coffee. Before leaving, she kissed my grandmother's cheek and said, "Love you, Mom. I'll see you soon." To everyone's shock, my grandmother squeezed her hand and replied, "Goodbye." She passed away within minutes of them leaving. When I worked in a secured Alzheimer's unit, one of my 99-year-old residents wheeled up to me and asked, "Honey, can I use your phone? I want to call my son before I die today." I told her, "No, Granny, you're not going to die today." But I let her use my phone anyway. After dinner, a CNA asked if I'd seen her so they could put her to bed. We searched for her and found she had quietly laid down in an empty room and died that evening. I was grateful I had given her that phone call. My grandpa passed just a week ago after several days in hospice. He was unconscious by the time I arrived, but the staff told us he could still hear, so I said everything I needed to. He wasn't particularly religious, though other family members were, so a priest visited. After discussing funeral plans, the priest took my grandmother's hands, bowed his head, and began, "Let us pray." At that exact moment, my grandpa suddenly thrashed, moaned, and groaned furiously in his bed, as if enraged. Even in that dark, heartbreaking moment, he somehow made us laugh. I miss him dearly. As a paramedic, I once had a patient in my ambulance slip into ventricular fibrillation. I watched the rhythm change on the monitor at the same time he did. Just before losing consciousness, he looked at me and said, "But I can't see the light." I shocked him, worked him, and rushed him to the ED, but he never regained consciousness and passed away. I'm an ER physician, and though I've heard countless last words, the most chilling came from a man dying of renal failure. With his final breaths, he cried out, "I see a bright light! Horses, no eyes, no!" As he began crashing, he suddenly revived for a split second, looked upward and whispered, "I understand." Then he died. Science explains these visions as the brain's final chemical storm, but sometimes I wonder if there's more to it than that. My grandfather died from diabetes complications after losing a leg. My uncle, his youngest son, was working abroad at the time. We told my grandpa, "Papa, you have to wait for Bruce to arrive." He asked, "How long?" We said, 17 hours. His last words were, 17 hours, huh? That's a long time. But okay. He went unresponsive shortly afterward and held on until about 20 minutes after my uncle arrived, just long enough to say goodbye. That man was tough as nails. Lost my mom a few months ago from COPD and heart failure. Her CO2 levels were climbing and she was on morphine for comfort. She had been unresponsive for a while, but at one point, my aunt and I stood on either side of her bed and she suddenly opened her eyes and asked, "Why is everyone here? What's going on?" My aunt gently told her we were just trying to make her comfortable because her lungs weren't working anymore. Mom nodded. "Oh, okay," as if it all made perfect sense. Later, she said softly, "He's waiting for me." We like to believe it was her father or maybe my aunt's late husband. She passed by 10 a.m. the next morning. She was only 54. Please never leave your love unspoken. I adored my ex-husband's mother, a fiery little Greek woman who didn't like many people but loved me and my daughters fiercely. I had the honor of caring for her during her battle with lung cancer. Near the end, she asked me, "Who's that little blonde girl running around smiling and waving at me?" None of our children matched that description. I truly believe she was seeing her guide, and I hope the same for myself someday. This one's family, not medical. My granny, heavily sedated with morphine, had been mumbling nonsense for hours. Then, with sudden clarity, she said, "When it gets dark, I'll see the dogwoods." Immediately after, she took her last breath. She had always loved Jesus, and dogwoods held deep religious meaning for her. It rattled my atheist mind, but I still miss her dearly. As a nurse, the eeriest moment wasn't something spoken. A patient, unresponsive for days, suddenly leapt out of bed, sprinted headfirst into the wall, and collapsed bleeding. She hadn't walked for a week. She died a few days later, and even in hospice, I've never seen anything like it. On the incident report, there was a line asking how the event could have been prevented. Honestly, I had no answer. Back when I was an aide, a man collapsed in the hallway. His words weren't creepy, but unforgettable. He managed to say he didn't want to go and told his family he loved them. A nurse asked if he was ready, and he replied, "No." What shook us was that by then we couldn't detect a pulse. As far as we could tell, he said his goodbyes after his heart had already stopped. I was an ER nurse caring for a middle-aged woman rushed in a wheelchair, clearly about to code, pale, sweaty, barely responsive. We quickly got her onto monitors, started IVs, gave orders. Amid the chaos, she suddenly sat upright, eyes wide, and screamed in Italian at the top of her lungs. Then she collapsed back, coded, and died. We couldn't bring her back. It felt like something out of The Exorcist. I'm a nurse, and this story came from a patient. She and her husband had a remarkable love story. She was a shy German girl during World War II, and he was a U.S. soldier. At first, she resisted him, but eventually, he won her over, promising her family he would marry her one day. They got engaged by letter while he was overseas. After the war, she moved to the U.S., and his family had everything ready for their wedding. They kept his promise of visiting Germany almost every year, except in 2001 because of 9/11. They were married for nearly 60 years, never apart more than 24 hours, raising children, grandchildren, and great-grandchildren together. On their anniversary, he kissed her goodnight and said, "Happy anniversary. I love you." By morning, he had passed peacefully in his sleep. Hearing her recount their life and his passing brought me to tears mid-shift. Not a medical professional's tale, but one from my own life. I was married to a man who traveled often. One Christmas, he was sick, but brushed it off. The night before a work trip, I felt this overwhelming sense of doom. I stayed up, making him share final wishes with me, just in case. The night before he was due back, I texted him an apology for any pain I'd ever caused, and he replied that he had forgiven me long ago and loved me. The next day, he never came home. A detective told me he had died shortly after sending that message. Those last words brought me comfort and saved me from years of guilt. Trust your instincts. Tell the people you love exactly how much they mean to you. Edit. For reference, my grandfather's own last words were, "I have to go. There,